Vraiment, c'est un jour à célébrer aujourd'hui parce que nous sommes ici pour célébrer. Celui qui fait du bien a besoin d'être célébré.
We believe that it's a day to celebrate because we believe whosoever is doing good is worthy of celebrating.
Ça me fait plaisir, vraiment, c'est un jeune, pas tout à fait jeune, mais c'est un jeune parmi la jeunesse, vraiment. Je pense bien qu'il y a l'avenir par rapport à la jeunesse.
We are happy because you are a young man, not young as like we, but we believe that you have so many years to contribute to the development of Africa.
Nous pensons, comme mon frère tantôt l'a dit tantôt, vraiment l'Afrique, si vraiment on se met la main ensemble, l'Afrique va aller de l'avance.
Just like our brother from Nigeria was saying earlier, we believe that what is workable in Nigeria is workable, can also work in Ghana, in Côte d'Ivoire, in Cameroon. So if we put our hands together,
nous pensons qu'aujourd'hui, les gens qui ont lutté contre l'Afrique aujourd'hui, ça soit comme Nkrumah, ça soit Félix Houphouët-Boigny, Thomas Sankara, ils ont commencé quand ils avaient jeunes et puis ils ont réussi les coins. Je pense qu'aujourd'hui, si on fait pour nous aussi, je pense qu'un jour l'Afrique serait un coin où les Blancs viendront, parce que l'Afrique serait un coin on doit regarder et puis suivre nos traces africaines.
Just like our forefathers are people that we are taking our steps after them, like the likes of Nkrumah of Ghana, Houphouët-Boigny, Nnamdi Azikiwe of Nigeria, and the rest of them. What they did at their time and they achieved, we are also trying to do that now, and we believe that as we are partnering with people, once you have accepted us in our partnership, we can do greater than what they did in their time and they achieved.
We have actually been seeing his own very work at the commission, him and his team, from of course taking the commission from just a paper framework in 2015 to 2016, and of course bringing it up to what it is today. Not just only that Africans, Nigerians, and Deltans in this very state have been able to be aware of the very scheme, and of course have as well taken advantage of the sensitization program to get enrolled into the health insurance scheme. We've as well seen him, or rather the commission, being the very diabetes, hypertension clinic centers within the very strategic locations in Delta State, and of course most importantly this very healthcare coverage system here in Delta State under its leadership has include most of the poor and the vulnerables. And of course we are saying that for Africa to as well attain the Pan-Africanism, which is one of our own very basic objective or concept, we must be able to ensure that healthcare system is in place. We have the mindset that a time will come, which will be very soon, people will no longer leave Africa to go for medical tourism abroad. And of course with what Dr. Ben Nkechika is doing, him and his team, we have seen that there is a lot more over there, and of course that is why you see Deltans and Africans who lives in this state are well taking advantage to enroll themselves in that very scheme, because we've seen the very broken health systems in Africa, but what they are actually doing here, it is very, very fantastic and it's well commendable. So we also expect a peer review mechanism, what is being done here to as well be duplicated, not just only in other states, but of course within the very African continent, because the problem of Africa is the same. Despite the very short period of time that they really started, they have become the enviable height to other states. In other words, they have become like more of a model to other states of Nigeria and Africa.
Students and youth, I present to you, sir, the African Student Union Parliament, a Pan-African Prize for Excellence, presented to Dr. Ben Nkechika, the Director and CEO of Delta State Contributing Health Commission for the Republic of Nigeria as icon of medical development in Africa. This is in recognition and appreciation of your selfless contributions to nation building, astute patriotism, philanthropy, your key support to the government, medical transformation, charity to the less privileged, meritorious service to God, humanity, country, and Africa on this day, July 2021.
We from the African Student Union Parliament decided to pay a courtesy visit and also encourage the Director General and CEO of this commission for his immense contribution towards positive transformation of the Healthcare Commission in the state. In Africa, health insurance is one of the parastatals that is very important. If you go down to the local government sector in Africa, you will see that there is no proper healthcare facility. This administration, through the governor, who has appointed a very young and vibrant man to head this commission, has been doing righteously well. He has been able to transform and put in place various healthcare facilities in these rural areas, which are very important to us.
Nous savons qu'en Afrique, partout, même ça soit la course, partout, la médaille est faite vraiment pour les champions. Aujourd'hui, nous pensons que la médaille aujourd'hui qu'on vous donne, c'est parce que vous êtes champion parmi les champions. Encore une fois, félicitations.
Because we don't generally medals are meant for champions, like somebody won the Euros, in sports, symbolic to run and get a gold medal. You didn't run, you didn't play football, but this medal means you are a champion to us. And mean a champion to us in our parliament, this medal signifies a five-star general. That's the highest rank in the village. So you are by this a 5-star adult general in our parliament. Quelle l'atmosphère ici aujourd'hui? Qu'est-ce qu'il s'agit? Pourquoi vous êtes là?
Bon, il s'agit de venir voir quelqu'un qui a contribué au niveau de médecine ici au Nigeria. Nous sommes ici pour célébrer avec lui, plus de merci, plus savoir ce qu'il fait ici au Nigeria et beaucoup vu à l'étranger.
We are here to celebrate with somebody that is contributing so much in the health sector. One, a very important sector in Africa that so many people are clamoring for. And what he is doing here has touched so many places in Africa and even the world. That's why we are here today.
The Pan-African Leadership Citation is for those individuals whose lives exemplify the ideal of living for the sake of others, an establishment of a culture of peace transcending race, national and religious barriers. A Pan-Africanist like yourself constitutes to the fulfillment of the hope for all ages. A unified Africa of peace, wherein the spiritual and material dimensions of life are unite. Congratulations.
Thank you, sir. The African Student Union Parliament Pan-African Corporate Mandate Service Delivery presented to management team and staff Delta State Contributing Health Commission, Federal Republic of Nigeria, in recognition and appreciation of their sincere and selfless commitment to nation health insurance, medical development, dedication to duties, teamwork, and dedication to national service, which is a prerequisite to national development in Nigeria and Africa. And congratulations to you all, sir.
Parliament, we preach Pan-Africanism, which is the development of Africa for Africa and by Africans. And what he's doing here in a Delta state in Nigeria should also be done in various African countries. That is what we preach. Immediately he said he's coming to Ghana. What comes in my mind is that I'll make a delegation of students from Ghana to also meet with him. Either in the conference, he will be there to tap from his wealth of experience. As I go back, I'll also try to meet with, I'll get the details from him. I'll also try and meet with the health delegation in Ghana government to be able to seek his contribution and knowledge to tap from his wealth of experience, because there's no doubt the director here, Dr. Ben, is a well-experienced young man. So what he's doing here in Nigeria, in Delta State, if he shares such wealth of experience to other African countries, we believe Africa will be great and greater again.
beaucoup les gens n'aiment pas trop l'apatriotisme ici en Afrique. Surtout la jeunesse, ils aiment trop fuir pour aller en Europe et en Amérique. Quel est votre message pour les Nigériens, surtout comme vous êtes le Nigeria, par rapport au fait du patriotisme?
Nous pensons que vraiment on a tout en Afrique ici, si on veut le dire. On peut aller là-bas pour apprendre, pour échanger avec eux, pour voir qu'est-ce qu'ils font chez eux là-bas, qu'on peut venir faire chez nous ici. Pas pour aller rester là pour la vie. Je pense bien que c'est le conseil qu'on peut donner à nos Africains. Et le monde, tu es libre de voyager partout pour aller apprendre, pas pour aller rester là-bas. Donc, je pense bien qu'aller là-bas, c'est pas mauvais. Il faut aller apprendre. Et puis quand tu viens chez toi, tu développes ton pays. C'est comme ça.
We believe that in Africa, in Nigeria, in Africa, we have everything that we want. Yes, you have the liberty to travel anywhere in the world, but let it be for peer review mechanisms and for you to go and learn. But whatsoever you learn, don't remain there. Make sure you bring it back to your country, you bring it back to your continent to contribute your own quota, just like Dr. Ben did in Delta State and Africa.
The fact is that whatever I do when I wake up in the morning, or what I achieve from waking up in the morning to going back to bed is able to save a life, is able to provide healthcare to somebody, is able to give somebody that opportunity of self-assertion, that ability to feel, to be a part of a system. I went to, the first day I went to Oporoza and Polobubo, I've never told the story. I was in a meeting and a chief, the king, called me and said, my son, come, I hear what you're saying. Can you please do your best to ensure that there's a healthcare facility operational in my kingdom before I go away? And I was like, what is going on here? And I said, well, he says he's the king of Egbema Kingdom. I said, oh, sir, please, I would like to come. At that time, I didn't know I was going to embark on a 3.5-hour journey by boat. But when Anna said, where's the place? He said, oh, it's in the river, it is. I said, okay, I have experience with traveling on water. And when I got there, you could see lively people. You could see human beings, people that should be entitled to good life. And I told myself the best I can do for them is to ensure that they have healthcare service. Because the healthcare service you provide for them will make them live better, feel better, be happier, be healthier, longer life, they are more productive, and then a vicious cycle of transferring good health to their children, their families. It's a complete cycle. So if you're able to do that, you take that burden off them, I believe that is what should work. So that's what drives me to be able to give life opportunity for existence, opportunity for good well-being, opportunity for feeling good to people. That's what drives me, and that's what I thank God that I'm able to achieve.